Hello, Sarah from South London Sling Library here. Today I'd like to show you how to use the BabyBjorn One Carrier with a slightly bigger baby. The baby that I'm going to be using today is around about the size of a sort of 10 to 12 week old baby. So out of the newborn phase, but not quite a great hulking toddler just yet. There's a little bit of setup that I want to do with my carrier to change it from the newborn size setting. So if I open my baby carrier, on the inside, you'll remember this zip from the newborn phase. I want to undo that zip and I'm going to zip this section up onto the next zip down. This is the, what do they call it, infant or baby/toddler position. So my baby's no longer in the newborn phase, so I'm moving this onto the baby size setting. What we'll do, once I've got the carrier on, we've got the baby in, we'll look at how to make sure that that's definitely the right setting for your baby. It will be different for different babies, but we can look at how you know whether or not it's the right setting for your baby at this point. I've also moved my back clip. It's on the runners on the sides, slightly lower. I find it more comfortable having it slightly lower than having it up on the back of my neck. So I'm then going to hold my carrier so that I can read that logo on the back clip, and I'm going to put it on like a jumper. Then rather than leaving that waistband where it is, kind of around my hips, it wouldn't be very comfortable for me like that. It would be tough to move around, and also if I wanted to sit down it would be quite awkward. Lifting the waistband changes the height for the baby. So what I'm going to do is I'm going to lift that waistband up to more or less my natural waist. And I'm going to do that up behind me, like that. I can then pull the straps on either side just to make it nice and snug so it's not going to move around while I'm carrying my baby. The other thing I'm going to do is here, at where the body panel joins the waistband, you've got some zips. For a newborn, you leave them open to give space for the baby's feet. For a slightly bigger baby, I'm going to close it a little bit and then lock it closed, so that I've got kind of halfway. So when my baby's sitting in the carrier, this supports to their knee pits. Then you can just close those zips incrementally as your baby gets bigger and their bottom and thighs extend further, and you need a little bit more support. You can grow the base of the carrier. That's about right for where my baby's at the moment, but I can check it again once my baby's in. So now I'm wearing the carrier, I need my baby. So this is Frankie. I'm going to hold Frankie on my front here, and I'm just going to encourage him to pop his legs up and spread his legs around me slightly, lift his knees, as babies are starting to do at this age anyway. And then I'm going to put my hand under the panel of the carrier and I'm just going to smooth it up Frankie's back, folding the headrest down so that it doesn't really come any higher than the nape of Frankie's neck. And then I'm going to get my buckles done up. So one's here, take it past the receiving end and slide it back in. Swap hands, the other buckles on the other side, under Frankie's arm, past the receiving end and slide it back in. Nice satisfying clunk. Then the top clips, again, down there and one there. And then you've got some narrow straps here. I'm just going to tighten these straps because it helps to keep this headrest fastened down. And it allows my baby to see a little bit more of what's going on around them, which once your baby's past the 4th trimester, they do really like to see what's going on. So allowing them that kind of field of vision just kind of helps. To tighten my carrier, you can see it's a bit loose. To tighten my carrier before I let go of my baby, my straps are on the sides here, so I'm going to hold that one, pull forwards. There we go. That's nice and comfortable now. I can then run my hands along the base of the carrier where the zips are and just make sure that the zips are in Frankie's knee pits. They're not extending my baby's legs straight out like that. They're allowing the baby to have a gentle bend at their knee. If I needed to, I could close those zips a little bit more, or I could open them if I'd accidentally closed them too far. So the safety guidelines in the BabyBjorn One are exactly the same as in any other sling or baby carrier. The word to remember is ticks. You want to tick all of your safety boxes. The T stands for tight. The baby should be as tightly held against you as if you were holding them in your arms. So I can put my hand on Frankie's head, do a little dip forward and not feel his body weight pull away from me. The I stands for in view. You should be able to see your baby's face without having to move any straps or any fabric out of the way. I can see his face very nicely. And this is about what you can see, not what people approaching you can see. The C stands for close enough to kiss. You should just be able to kiss your baby at any point. The K stands for keeping baby's chin off baby's chest. And the easiest way to know that your baby's chin is off their chest is to do the ugly double chin manoeuvre and make sure you can see the top half of your baby's face. The S stands for supported spine. If you pop a hand on your baby's back and lightly press, they don't have extra room to uncurl or get closer to you or sit up. If you've tried this size setting and your baby is still too small, what happens is when you do the carrier up, your baby kind of disappears inside the carrier, in which case I would take the carrier off, put the zip back onto the newborn size setting and continue wearing it on that size setting for a little bit longer until your baby's gained an extra inch or so in height, and then you can try again. That's it. To take the carrier off, I'm going to support the baby's weight. I'm going to do the clips at the top first, 1, 2, and then the side clips. Squeeze and push towards the centre of the carrier and then bring away. Same on the other side, squeeze, bring towards the centre of the carrier and then pull away. And I can get my baby out like that. I hope that helps. If you'd like to borrow one of our BabyBjorn Ones, you can find them on the Sling and Carrier Hire page of our website, which is southlondonslings.co.uk. I hope to see you soon. Thanks a lot. Bye.